Welcome to this beautiful day. It's so hard to believe that a year ago, the Maryland that we know was under a stay-at-home order. It is still a sad and harsh reality that across the world in places such as India, Sri Lanka, and Cambodia, cases of COVID-19 are still skyrocketing. We stand here grateful for where we are here in Howard County. In fact, fewer than 5 months ago, Howard County received its first shipment of vaccine doses to administer to our residents. From that point, it has been a race, vaccine versus variants. Our team has worked furiously to stand up large clinics and manage the many questions and concerns of our community. This was a monumental collaboration between the health department, county government, our educational institutions, and our private partners. And I thank all of our frontline workers who have worked to get us to where we are today. Due to their dedication and their efforts, 75% of our Howard County residents over 16 have already received their first dose. This was not by chance. It was because we efficiently worked through the initial prioritization all the way to this point in time where vaccine is now widely available in Howard County and throughout the state of Maryland. It's because of our intentional targeting that we now have fully vaccinated approximately 100% of our 75 plus residents. 95%, or 90% rather, of our residents 65 to 74, and more than 70% of our residents 51 to 64. We've also worked to eliminate many barriers to getting a vaccine for people of all abilities, races, and socioeconomic levels. We brought vaccine to those with mobility challenges. We ensured our call lines were staffed to meet the needs of residents with limited English proficiency. And we enlisted the help of many of our nonprofits to close the digital divide and assist residents with registration needs. As more vaccine became available, we evolved our strategy of large clinics and added mobile, community-based clinics. I'm especially proud of our mobile integrated community health team who has been administering vaccine in homes for our developmentally and intellectually disabled residents and other vulnerable community members for several months now, and has been a model for our state and our nation. Our MICH team has administered nearly 600 vaccine doses for homebound residents and partnered with other trusted sources like assisted living homes, our faith community, and neighborhood centers to bring the vaccine to more of our residents. They've administered 1,629 doses to staff and residents at independent living homes, our detention center, nursing homes, and congregate facilities. Since our first community clinic at St. John Baptist Church, we've administered over 4,500 vaccine doses at faith-based clinics. And with these clinics, we've made progress on equitable vaccine distribution, reaching many residents who might not have been able or have been hesitant, or maybe even just needed support from their close-knit community to get their shot. In total, our health department and partners have administered approximately 86,000 vaccine doses to many of these harder to reach communities. In Howard County to date, about 16% of our African American residents have received their first dose, and we have about 18% here as far as our population. Our Asian American residents, about 18% have received their first dose, which actually matches the population here in Howard County. And for our Hispanic residents, while they represent about 7% of our population, we've gotten to about 5% who have their first dose. Across all of our demographics, we still have to get our young people vaccinated, and we know that the largest disparities in race are among our residents age 49 and under, while those over 50 have been vaccinated at about equal rates. We recognize that these smaller clinics were well received by our community. It removed barriers like transportation or the need to make an appointment, and are more convenient to many of our younger residents who are balancing work, childcare, and other priorities. For many people, getting vaccinated might not be on your to-do list because there's not necessarily a convenient time or location. However, we've eliminated those challenges, and we want you to make sure it's on your to-do list. 75% of our residents 16 and over are at least partially vaccinated, and now we're focusing on that last 25%. In the past 2 weeks and over the next month, we are bringing clinics at convenient sites throughout all of Howard County. Wherever you're heading, we have a place for you to get vaccinated. We'll be on Baltimore National Pike, at the H Mart, or in the Normandy Shopping Center. We'll be at schools, places of worship, community centers. We're in Columbia, Elkridge, Loyal, Laurel, Ellicott City, and Jessup. We could be available right outside your apartment building. And we'll be right here where you can get a jailbreak brew and your COVID-19 jab. All of these clinics allow you to make an appointment or just walk up if you're passing through. All of our mobile clinics, in addition, are to our newly opened mass vaccination site at the mall in Columbia. And as you can see, we've made vaccine access and vaccine equity priorities as we work together to beat COVID-19 and to save lives. For many of our residents who are eager to get their children vaccinated, the mall in Columbia is mostly administering Pfizer vaccine, which was just approved for 12 to 15-year-olds this week. With all of these options, it's never been easier or more convenient to get vaccinated. And we're all safer when more people get vaccinated. While Howard County leads the state of Maryland in the number of residents vaccinated, we will not rest until everyone who wants a shot gets a shot. We need everyone to do everything possible to get our friends and family vaccinated so together we can beat this pandemic. Thank you.
Thank you, County Executive Ball. Now we'll hear from Howard County's Health Officer, Dr. Maura Rossman.
Thank you. Thank you, Angela, and thank you, Dr. Ball. It's a beautiful day to be out. Howard County is leading the state in its percentage of residents vaccinated, with 46.6% fully vaccinated and 60% having recently received received one dose. The county executive mentioned the 75%. I'm using the total population just to give you more numbers for reporting. But 75% of those eligible 16 and up, a truly remarkable number, have at least one dose. And to date, Howard County Health Department and its collective partners have vaccinated more than 86,000 people in our county. Today, we have a 1.5 positivity rate and a 3.6 per 100,000 case rate. These numbers are incredible and very, very promising. It's a testament to our neighbors, our friends, our family, and all of us including the staff of Howard County Health Department, Howard County Government, Howard County Fire and Rescue, Community Resources, the police, Rec and Parks, and I could go on, who have made this possible. Today, our children, 12 to 15, can become vaccinated so they can safely resume activities and events missed over the past 15 months. Over the last months, it has been critical to evolve and change strategies to reach other members of our community. While we continue our larger scale clinics at Howard Community College, Ascend One, and the Mall, we understand it is vital to be accessible to those who may be less able to utilize those sites. To that end, as discussed by County Executive, we have added mobile vaccination teams to increase vaccine access to homebound individuals. We've implemented inclusive clinics designed to provide physical and sensory supports for individuals with developmental and cognitive disabilities. We established clinics at community and residential sites where COVID cases are higher and vaccination uptake lower. We worked with our community partners to vaccinate employees at their job sites, set up clinics at restaurants and other hospitality sites like this one, where later this afternoon we will hold a clinic for workers and patrons alike. Providing a multitude of options for vaccination allows those who are vaccine amenable but not yet vaccinated the opportunity to do so conveniently and easily, thus reducing the barriers to access and increasing the probability of vaccination. Holding clinics is only part of the equation for moving people toward a decision to become vaccinated. The health department has collaborated with community-based organizations to build vaccine confidence by communicating accurately, timely, culturally, and linguistically appropriate information for individuals to make informed decisions about vaccination. We have provided funding opportunities to community-based and faith-based organizations to reach communities disproportionately impacted by COVID-19. Our multi-pronged approach to vaccination has led to an evolution in clinic offerings, the utilization of community partnerships, and the funding of community organizations in an effort to vaccinate as many in our county as possible, with the hopes of eradicating this virus and returning to life with family events, neighborhood get-togethers, and other activities we've missed for 15 months. Thank you for partnering with us.
Thank you, Dr. Rossman. Now we'll hear from Fire Chief William Anuszewski. Thank you.
Good almost afternoon. Thank you, Angela. Every day, we take a collective step forward in returning to normalcy here in Howard County. Every day there is an opportunity to be vaccinated. We take that step. But those opportunities are not always the same for everyone, and that has been our focus here in Howard County. With the leadership of Executive Ball and his staff, the work of Dr. Rossman and her staff, the collective MICH group, including Fire and Rescue, Department of Community Resources and Services, Recreation and Parks, and all the county employees that have staffed the clinics, we are taking the vaccination model to every level possible. From the mobile integrated community health perspective, we started with homebound patients, independent living facilities, and congregate living facilities. As we continue to progress, we moved into community faith-based facilities and community centers. Now, we are providing pop-up clinics at shopping centers and apartment or townhome communities. Our goal, if you want to get a vaccine, we want to provide you that opportunity to get it, to everyone. Almost 600 vaccinations have been given to homebound patients and over 4,400 in the faith-based communities. Nearly 700 at shopping centers and businesses, and over 250 in apartment and townhome communities. So if you see us out there and you want to get a vaccine, stop in. These are the steps back to normalcy, and we will continue in working to help us all get there. Thank you.
Thank you, Chief Anuszewski. And now I'd like to welcome Katie Collins-Erkey, who is the Executive Director of the Accessible Resources for Independence organization.
Hello, and thank you. I am so excited to be here to talk about progress made with disability access for people with disabilities. ARI, Accessible Resources for Independence, is a disability resource and advocacy organization run by people with disabilities, for people with disabilities in Howard County. So much progress has been made for people with disabilities to get their vaccine. As you may know, 1 in 4 people are people with disabilities. It's likely either you or someone you know is a person with a disability. And disability crosses all over demographic lines. People with disabilities often have trouble accessing transportation, healthcare, housing, and employment, and in times like these, vaccines. One way to make vaccine access easier is by breaking down barriers. I'm impressed by the speed and efficiency that Howard County took to address barriers to people with disabilities receiving the vaccine. The clinics were made very accessible. ARI actually worked in partnership with the state of Maryland and Howard County Health Department to run a clinic, and it turned out very well. We had extra room in the waiting area for support staff, as well as those who use wheelchairs. We've reached an important and very exciting milestone. 60% of Howard County total population has received at least 1 dose of the vaccine, and we're beginning to see the light at the end of the tunnel. If you or someone you know needs a vaccine, don't delay. There are plenty of places to get one, and help is out there if you need it. In the spirit of Hamilton, don't throw away your shot. Thank you.
Thank you, Katie. And now I'd like to also introduce another amazing community partner, Padre Leandro Fazzolini, who's the Associate Pastor of St. John the Evangelist.
During this pandemic, we all lived many fears. The fears of losing a loved one, the fears of not being able to go back to a normal life. Durante esta pandemia, nosotros vivimos muchos miedos de perder a una persona amada o de volver a la realidad de nuestras vidas. But one thing is very important. We never lost hope. And with the vaccines, we have our hopes back. Now we can go back to our normal lives, loving those that are part of our lives, our neighbors, and everyone that work, that we meet, everyone that we care. Con las vacunas, nosotros podemos volver a tener una vida normal, amando a las personas que son nuestros vecinos, nuestras amistades, a todas las personas que hacen parte de nuestra vida. Nosotros nunca hemos perdido la esperanza. Por más miedo o temor que teníamos, la esperanza siempre vence. So, dear brothers and sisters, let us never lose the hope. Let us walking always towards the good and towards the loving care that we can give to our brothers and sisters, to our neighbors. Por eso, queridos hermanos y hermanas, jamás percamos la esperanza y sigamos siempre amando a nuestros hermanos y hermanas, a nuestros vecinos.
Muchas gracias, Father Leandro. Thank you. And now we'll hear from Stephanie Adibe, who's the Deputy Director of the Department of Community Resources and Services.
Good morning, and thank you, Angela. DCRS continues to work closely with the Howard County Health Department, the Department of Fire and Rescue, and the Department of Recreation and Parks to provide equitable opportunities for vaccine access countywide. From the beginning, we developed and engaged in a strategy focused on meeting people where they are. We have and continue to partner with our faith-based communities to stand up clinics on site, congregate living facilities to provide vaccines to their staff and residents, and with other nonprofit and school partners. To date, our community clinics have included residential complexes, community centers, parks, restaurants, and other areas for popular areas for shopping or community engagement. In addition to partnering with employers to conduct clinics at a variety of workplace locations. All of these efforts are designed to provide convenient access to vaccine and remove barriers to registration due to technology or language, and we have already administered 1,000 vaccines at our pop-up locations. To ensure that we are able to continue providing vaccines to our community at an increased rate and pace, we are partnering with the Howard County Health Department to provide $1 million in grant funding to community organizations and eligible healthcare entities in a community-wide COVID-19 prevention and vaccination effort. This is particularly important as we strive to reach our most vulnerable communities and communities of color. We are proud to be among the state's leaders in reducing infection, hospitalizations, and deaths related to COVID-19. We look forward to continuing to work with our communities to stay COVID safe and moving forward towards the full return to the quality of life Howard County residents know and enjoy. Thank you.
Thank you, Stephanie. And now we'll hear from Stephanie Wall, who's the Strategic Outreach Coordinator in the Office of the County Executive.
Good morning. As was already mentioned, my name is Stephanie Wall. I'm the Strategic Outreach Coordinator out of the Office of the County Executive. I work in partnership alongside of Stephanie Adibe, who works out of, as you just heard, Department of Community Services, let me get it right now. The Department of Community Resources and Services, alongside the Health Department and the Fire Department, we have a coordinated, integrated approach to happen to get vaccinated. So our office has built relationships and maintained a constant contact list with over 100 faith-based organizations, which includes churches, mosques, synagogues, and the list is extensive but not exhaustive. And due to this partnership between the government and the places of worship, we've had an opportunity to vaccinate over just about 4,500 adults here in Howard County. We thank all of our partners and volunteers and within the organizations, all the students who've come out, who've helped to volunteer and serve in these clinics, because you've made a significant difference, and we honor you. We have a community clinic scheduled for today at the United Methodist Conference Center in Fulton, which is in Maple Lawn. It is at 11711 East Marketplace in Fulton, Maryland. I'll say that again. It's 11711 East Marketplace in Fulton, Maryland. And you can walk up or you can register, but no registration is required. Thank you for your time and attention.
Thank you, Stephanie. And now that concludes our formal remarks, but we're going to open it up to the press if there are any questions. Hearing none, we're going to wrap up. Thank you again to all those who are tuning in on Facebook, and thank you all for joining here today.